Your dog stretches out on the rug to sleep, and a dry cough comes out of nowhere, hacking, like something's caught in his throat. It happens again the next night, and then the night after that, and you've probably already told yourself it's nothing, dry air, a tickle, something he'll shake off by morning. Here's the part almost nobody gets told. A failing heart in a dog rarely looks like a heart attack. It looks like six small moments spread across months, each one easy to explain away as old age, hot weather, or just a slow day. Most of them show up while your dog is doing nothing more dramatic than resting on the rug beside you. And the sixth one, the one we're building to, is the one almost every owner waves off completely, right up until it turns out to be the loudest signal of the whole list. Grab a pen if you want to jot these down as we go, because catching even one of these months early changes what your dog's own vet can actually do about it. And to be clear from the start, none of this replaces whatever your vet ends up deciding. Once you're in that room together, it's about handing them a fuller picture sooner, instead of showing up after things have already gotten loud. Nobody hands a new dog owner a manual on what a tired dog is supposed to look like versus a dog whose heart is starting to struggle. If you've ever said, he's just getting older about a cough or a slower walk, that's not you missing something obvious. That's exactly how this disease is built to hide. And the fact that you're here, turning it over in your head enough to watch this, already says something about the kind of owner your dog has. There's a myth wrapped up in all of this that's worth pulling apart first, because it's the reason these six signs slip past so many people. Most owners picture heart trouble in a dog the way it plays out in movies: a sudden collapse, a dramatic moment, over in seconds. Real canine heart failure is almost never that. It's a slow leak, not a snapped wire. A valve wears down, bit by bit, or the heart muscle stretches out gradually, and the body compensates so quietly that everything can look normal for a long stretch before it doesn't. Waiting for the dramatic version is exactly why the quiet version gets missed, and it's worth sitting with that for a second because everything else in this video builds on it. So what's actually happening inside? Picture the valve on the left side of the heart as a one-way door that's supposed to seal shut every time it closes. In a lot of aging dogs, especially small breeds, that door starts to leak a little, letting blood slosh backward instead of moving forward the way it should. The heart's still trying to do its job, but it's pushing against its own backwash, like an old water pump that used to fill a bucket in 10 seconds and now needs 20 for the same amount of water. That kind of wear doesn't happen overnight either. It can take months or even years to reach the point where it produces a sign you'd actually notice from the couch, which is part of why these early moments matter so much more than owners tend to assume. When that backward flow builds up behind the left side of the heart, it pools in the lungs. That's congestion, which is the actual meaning behind the medical term congestive heart failure, fluid sitting somewhere it isn't supposed to sit. Think of a bathtub with a half-clogged drain. The water level in the room keeps creeping up even though nothing new is being poured in. That fluid against the lungs is what triggers a cough. And it's also what makes a dog's breathing rate climb, even when he's just lying there asleep. When the right side of the heart starts struggling too, that same kind of fluid backup shows up lower down, in the belly. It's also part of why human cough syrup does absolutely nothing here, no matter how dry or persistent that cough sounds, because syrup was never built to move fluid out from around the lungs. Only an actual diuretic your vet prescribes can do that. That one mechanism explains more than half of what you're about to hear, so keep that leaky door and that half-clogged drain in your head. It's the thread that connects a cough at bedtime to a belly that looks a little fuller than usual, and it's why these six signs aren't six separate problems. They're six windows into the same slow leak. Sign one is that cough, and it's worth being specific about what makes it different from an ordinary one. A dog coughing once because he gulped his water too fast is nothing. What's different is a dry cough that repeats specifically when your dog lies down to rest, or one that wakes him at 2 in the morning for no reason you can point to. That timing, tied to lying down, is what separates a throat tickle from fluid sitting against the lungs, and it's worth a call to the vet within days, sooner if it's happening more nights than not. If you're ever unsure whether what you're hearing actually counts, a quick voice memo on your phone during one of these coughing fits costs you nothing and gives your vet something concrete to listen to, instead of you trying to describe a sound from memory in the exam room. Sign 2 is tiring faster than he used to, and every dog has an off day now and then. So this one is about the pattern, not the single afternoon. It's the dog who used to finish the whole walk now stopping halfway, or the one who used to chase a ball for 20 minutes now quitting after 5, and doing it consistently, week after week, not just once when it's hot outside. When the heart can't push enough oxygen-rich blood out to the muscles, tiring faster is often the first thing an owner notices, and the first thing they explain away. In small and toy breeds, this sometimes shows up first as reluctance to jump onto the couch or the bed, a jump he used to make without thinking twice, which is worth watching for on its own, separately from how the actual walks are going. That's 2 sides down, and honestly, if all you take from this video is learning to notice that cough at bedtime, you've already got something real to bring to your next vet visit. That's worth pausing on for a second. If you're watching this from your couch right now with your dog curled up somewhere nearby, drop a comment with where you're watching from. It's always something I like seeing. Subscribing helps this kind of information reach more owners before their dogs are in crisis, and a like does something similar. It just tells the algorithm to put this in front of more people who need to hear it tonight. None of that takes more than a second, and then let's keep going, because the next sign is one you can actually measure with a stopwatch. And measuring is exactly where this starts connecting to something bigger than any one sign on its own. Because here's the part that catches almost every owner off guard. A cough at bedtime or a slower walk almost never shows up by itself. It tends to travel with a handful of other small changes in a dog's day. Things that only start making sense once you see them laid out together as one picture instead of 6 separate worries. If you're not sure how the pieces in your own dog's routine fit together, or which one actually matters most right now, we put together a free 2-minute quiz that reads your dog's bigger picture and points you toward where to start. You'll find the link in the pinned comment, or you can scan the QR code on the screen. Take it after this video finishes though, because the most important piece of what we're building toward is still ahead, and it's worth having the full picture before you go looking for where to begin. Sign 3 is one you can actually put a number on tonight, and it's the one vets ask owners to track more than almost anything else. Panting hard after a walk or on a hot day is completely normal. What's different is your dog's breathing rate while he's fully asleep. Calm, not dreaming, not twitching. Count his breaths for 30 seconds and double it, or count a full 60 seconds if you want the most accurate number. Somewhere under 30 breaths a minute at rest is the range most dogs sit in normally. Consistently above 30, night after night, is the number that means it's time to call the vet, not a sign to manage at home on your own. Check it 2 or 3 times a week, roughly the same time each night, because one single count matters far less than whether that number is climbing. Sign 4 shows up somewhere you never think to connect to the heart at all, which is the belly. A dog looking a little fuller after a big meal is nothing. What's different is a belly that stays firm for days at a time, even when he hasn't overeaten, even when his weight elsewhere looks about the same. That can mean fluid pooling low in the body, the same backward pressure from earlier, just showing up somewhere lower down instead of in the lungs. Owners tend to notice this one last because a fuller belly reads as a food thing long before anyone thinks to connect it to breathing or energy. In a small dog, it can look almost like weight gain around the middle. In a large dog, it often shows up more as a firmness you feel with a flat hand against his side than anything you catch just by looking at him across the room. And that's really the pattern worth sitting with for a second. None of these 4 signs look dramatic on their own. A cough here, a shorter walk there, a number you have to count to even notice, a belly that's a little rounder than it used to be. But strung together, they're the same slow leak, showing up in 4 different rooms of the same house. Left alone, that leak doesn't stay small. Mild fluid in the lungs that causes an occasional cough can, over time, progress into labored breathing even while resting. A mildly swollen belly can progress into distension, firm enough to press against the lungs and make lying flat genuinely uncomfortable. None of that happens overnight, but it is the direction things move without treatment, which is exactly why catching this early changes what's actually possible. Picture a dog like Milo, an 11-year-old Cavalier King Charles Spaniel, a breed that tends to be especially prone to this kind of valve wear as they age. His owner had noticed him coughing some nights and figured it was just dry air in the house during winter. A vet visit, an echocardiogram, which is simply an ultrasound picture of the heart while it's beating, and a couple weeks of tracking his breathing rate at night told a fuller story. Milo started on heart medication his vet prescribed, alongside a lower sodium diet and a vet-approved fish oil routine. A few months in, the nighttime coughing had eased noticeably, and he was finishing his usual evening walk again. Not every dog responds exactly that smoothly, and how much medication helps still depends on the individual dog and how early the vet catches it. But Milo's story is the shape this usually takes when it's caught in time instead of after a crisis. Ezel. Sign 5 is the one that's easy to miss because it requires actually looking, which is your dog's gum color. Gums vary a little from dog to dog, but healthy is almost always some shade of bubblegum pink. What's different and genuinely urgent is gums that look pale, grayish, or carry a blue tinge, especially around the tongue or lips. That color shift can mean oxygen isn't circulating through the body the way it should, and unlike the first 4 signs, this one isn't a wait-and-see situation. Pale or blue gums call for a same-day vet visit, not a same-week one. One more way to check while you're at it is capillary refill. Press gently on the gum until it turns white, let go, and count how long the color takes to return. Under 2 seconds is normal, and anything that lingers noticeably longer is worth mentioning at that same visit, alongside the color itself. And then there's sign 6, the one we opened with, the one almost every owner dismisses completely because of how fast it resolves. It's fainting, or a brief collapse. A dog stumbling on a slick kitchen floor happens to plenty of healthy dogs and means nothing. What's different is a dog who suddenly goes limp, loses consciousness for a few seconds, usually right after excitement or exercise, and then gets up a moment later acting like nothing happened at all. Because he bounces back so fast, owners tend to write it off as a trip or a slip. But that brief blackout can mean blood flow to the brain dropped for a moment, and it's often the loudest warning on this entire list, precisely because it's the one people talk themselves out of. Any fainting episode, even a short one, deserves an urgent call to the vet, and one that doesn't resolve within a few seconds is an emergency, not a wait until morning situation. Left completely unaddressed, those fainting spells tend to grow more frequent over time because the heart is working harder each time to keep blood moving to the brain at all. Fully unmanaged, this kind of heart disease is progressive, and in its more advanced stages, it becomes life-limiting. That's the part that makes the first 5 signs worth catching early, because slowing that progression is genuinely more possible before things reach this point than after. None of this is about fixing a diagnosed heart condition from your kitchen. It's about giving your dog's own heart some support alongside whatever your vet decides, and about being the kind of owner who notices something is worth checking months before it becomes an emergency. The first piece is omega-3 fish oil, specifically the EPA and DHA in it, which can support a healthier heart rhythm and may help ease some of the inflammation tied to heart disease. Cardiac-focused dosing tends to run around 40 milligrams per kilogram of EPA plus 25 milligrams per kilogram of DHA a day, which works out to roughly 130 to 150 milligrams of combined EPA and DHA per 10 pounds of body weight for a small dog, more for a medium dog in the 30 to 50 pound range, and proportionally more again for a large dog over 70 pounds. Always dose off the actual EPA and DHA numbers printed on the label, never the total oil volume, and confirm the exact amount with your vet, since heart-specific dosing runs meaningfully higher than a general coat and skin dose, and too much can thin the blood more than intended. The second piece is sodium, or more specifically, cutting back on it. Extra salt makes the body hold on to extra fluid, which is exactly the wrong direction for a heart that's already struggling with fluid buildup. Swapping some daily treats for unsalted green beans, small pieces of plain cooked chicken, or treats labeled low sodium replaces the salty, jerky strips and cheese-dusted snacks that add up more than most owners realize. Cut sodium gradually and with your vet's input rather than all at once, especially if your dog is already on heart medication, since some of those medications still need a certain sodium balance to work properly. For a small dog, that might mean trimming down to 1 or 2 salty treats a week instead of 1 a day. For a large dog, eating a bigger volume of treats overall, the swap matters even more, simply because the sodium adds up faster across more food. The third piece is the measuring habit from sign 3, turned into something you actually do. Count your dog's breaths for 30 seconds while he's fully asleep, double that number, or count a full 60 seconds for the most accurate read. Do it 2 or 3 times a week, roughly the same time of night, and track the number somewhere instead of trusting your memory. One count tells you almost nothing. A rising trend over a couple of weeks tells you almost everything, and it's the single easiest piece of information you can hand your vet at the next appointment. If the number keeps climbing while you're between scheduled visits, most vets would genuinely rather get a call or a message with your log than have you wait for the next appointment on the calendar. Since a rising trend is exactly the kind of thing they want to hear about early, not after it's turned into an emergency. One more thing before you start any of this. Never reach for human cough or cold medicine for that nighttime cough. A lot of those contain ingredients that are outright toxic to dogs, and none of them do anything about fluid sitting against the lungs anyway, which needs an actual prescribed diuretic, not syrup from your own medicine cabinet. Keep garlic, onion, grapes, and raisins, xylitol, sometimes labeled birch sugar on ingredient lists, and any essential oil, especially undiluted, well away from a dog with heart concerns, since heart medications already put some strain on the kidneys and liver, and those particular toxins add more. And none of this, not the fish oil, not the low sodium treats, not the breathing count, replaces an actual echocardiogram or blood work. A persistent cough, a climbing breathing rate, pale or blue gums, a swollen belly, or any fainting episode is a reason to call the vet that same week. And blue gums, or a collapse that doesn't resolve in seconds, is a reason to go in right now. Don't start all 3 of these on the same day, by the way. A dog's stomach handles one new thing at a time far better than 3 at once. Start with the low sodium treat swap in week 1. Since it's the lowest risk change, add the fish oil in week 2 at a lower dose, and only then start tracking the breathing rate as your third habit. That way, nothing gets abandoned because it felt like too much at once, and you've got a real system running inside a month. A struggling heart rarely stays contained to just the chest either. Reduced blood flow puts extra strain on the kidneys too, which is part of why a vet will usually run blood work alongside a cardiac workup rather than looking at the heart in isolation. And that same low sodium swap that helps the heart tends to take some pressure off the kidneys at the same time, so it's rarely wasted effort even if the heart turns out to be fine. Mitral valve disease specifically is the most common heart condition in aging small and toy breeds, and it shows up especially often in Cavalier King Charles Spaniels, which is worth knowing if that's your dog's breed or mix. Because the heart and kidneys lean on each other so directly, a vet treating one will usually keep an eye on the other automatically, which is one more reason this is a partnership with your vet, not something to manage entirely from your own kitchen. So here's where that leaves you tonight. Somewhere between the cough at bedtime and the fainting spell that resolves in seconds, there are 6 small windows into the same slow leak, and every single one of them is something you can actually watch for starting tonight, not next month. If you've never once counted your dog's breaths while he was sleeping, that's a completely normal place to be starting from, and it's worth telling me in the comments whether you have or haven't. Just a word is enough. If any of this felt useful, subscribing helps it reach more owners before they're standing in an emergency room instead of a regular vet visit. And that free 2-minute quiz is still sitting in the pinned comment or on the QR code on your screen whenever you're ready for it. For tonight though, maybe just go sit near your dog for a minute, put a hand on his chest, and notice how he's breathing. That's really where all of this starts.